Ewan, thank you very much. Good morning and thank you for the opportunity to address you. And can I also acknowledge the traditional owners, the Ngunnawal people, pay my respects to their elders past and present, and also acknowledge their ongoing spiritual relationship with this land. I also acknowledge Minister Susan Lee, who's just left, Assistant Minister David Gillespie, and both Ewan McPhee, your President, and Lucy Walters from Akram. I also noticed earlier on this morning Dr Bastian Seidel from the RACGP as well, who's the President. As rural doctors, some of you working in remote areas, under the most demanding conditions, you deserve our continued gratitude. I'm aware that many of you work long hours and operate on tight margins, and you strive to deliver the healthcare those of us in the city take for granted. I also understand that as rural doctors, you have to expect the unexpected and often deal with complex health matters that city doctors can often refer to a nearby hospital or onto a specialist. For that reason, extra skills are required, and I note the pre- and post-conference workshops on rural emergency skills training and advanced life support that have been organised. Whilst we continuously hear from the government about the rising costs of health and medical services, we do not hear enough about the unique and divergent challenges of health professionals working in rural and remote Australia. These challenges fall into what I would refer to as two areas. Firstly, workforce matters, which of course vary from one region to another. Secondly, the generally poorer health of people in rural and remote Australia when compared with other Australians. No sector would understand those matters and the contributing factors to them better than yourselves. Through this conference, I trust that you will not only be able to have your voice heard, but to also further develop the election platforms that you put forward earlier this year. I particularly noted the Australian College of Rural and Remote Medicine's policy priorities in the lead up to the last federal elections included, and it's not comprehensive, but included, training and retaining rural doctors and improving infrastructure and maintaining life-saving services in rural hospitals and healthcare facilities. The Rural Doctors Election Platform called for additional funding to address the systemic healthcare inequalities. On that score, you have an arguable case when one considers that the health spend per individual in remote areas is $546 a year compared with $910 a year in major cities. The correlation between inequality and poor health outcomes is well documented. Many of the communities you work within are already struggling. That's why the government's MBS freeze, increase in costs of medicines, cuts to pathology bulk billing incentive payments, proposed abolition of the Child Dental Benefit Schedule, and any attempts to introduce a GP co-payment will disproportionately impact on rural and remote communities and in turn on yourselves as health providers. By contrast, in the recent federal election campaign, Labor committed to reversing cuts to the Medicare bulk billing incentives for pathology and diagnostic imaging, price hikes to PBS medicines, cuts to the Medicare safety nets, cuts to public hospitals over the next 4 years, and importantly, to reverse the Medicare rebate freeze. Further jeopardising the viability of rural doctor practices is the wrong thing to do when the challenge is to get more health professionals into rural Australia. Similarly, the government's decision to abolish Health Workforce Australia impacts more so on rural and remote health workforce because that is where the largest imbalances exist. Your focus on workforce matters is therefore understandable, and I note your 2016 election platform reference to mechanisms to promote and sustain rural general practices, including sufficient investment in physical and technological infrastructure and adequate recompense for the advanced skills, scope and complexity of practice required of rural doctors, and rural recruitment and retention strategies, and especially a national rural generalist training program. Labor's response and election commitment was to establish the Australian Healthcare Reform Commission and Centre for Medical and Health Systems Innovation, which would have been tasked to roll out agreed structural reforms to Australia's healthcare systems. The Commission would also have taken on the role of Health Workforce Australia. Labor also indicated support for a national rural generalist pathway. I want to touch briefly on two other matters which rural doctors and other rural health professionals are at the forefront of health service delivery, and I refer to mental health and Indigenous health. Indigenous people experience a higher burden of ill health, which is 2.5 times worse than for other Australians. For years, governments have endeavoured to lift Indigenous health outcomes with limited success. In 2008, Kevin Rudd and Brendan Nelson together signed the Close the Gap statement, which included specific health targets. Each year, progress is reassessed. We still have a long way to go. It remains a matter of priority, and your role cannot be overstated. As part of Labor's 2016 election platform, an additional $28 million was allocated to address eye health, kidney disease and healthy living amongst the Indigenous community. Of course, we were not elected, and those needs still exist. Warren Snowden, who was here at the breakfast earlier today, and the member for Lingiari, has responsibility for rural health on our side of politics, and I couldn't think of a better person for that role. The final issue is the growing need for mental health services in rural Australia and the additional demands and responsibility being placed on doctors as a result. It is a matter I heard about so often as a committee member of the Parliamentary Committee that listened to Murray-Darling Basin communities in Queensland, New South Wales, Victoria and South Australia at the end of the 10-year drought. Rural GPs are at the coalface of dealing with mental health problems, particularly when other services are not readily available. The additional demand and responsibility on rural doctors must be acknowledged and factored into government policies. Labor recognised this with our commitment at the last election to establish regional trials of suicide prevention services and use the primary health networks to deliver regionally tailored mental health services. 4 were to be located in rural areas and 2 in remote areas. Labor also committed $100 million for our patient-centred medical homes initiative. Between now and the next federal election, I will be working with Catherine King and other shadow ministers in Labor's health team in developing Labor's health policies. Your expertise and discussions with us about rural health policy will be invaluable, and the outcome of your conference will be of interest to us. I thank you for your time, and I wish you an enjoyable and productive conference. Thank you very much.